Hi, I'm Dr. Nikole Benders-Hattie, psychiatrist and the Chief Medical Officer of Talkspace, here with FitOn. Today, we're talking about making stress management a habit. Stress is a natural response to increased pressure in our lives due to a change in our environment or a threat. It's normal and even healthy in some cases. The stress response stems from primal survival skills. It's called the fight or flight response because our ancient ancestors more frequently faced threats like wild animals they needed to prepare to fight or run away from. So the body releases stress hormones like cortisol and adrenaline to prepare us. Stress gets a bad name, but it's important to realize that some degree of stress is just a normal part of life, and sometimes stress can be good. Yes, there is such a thing as good, positive stress. It helps with things like motivation and focus. Some examples of positive, or what we might call productive stress, might be when you're working toward an important but manageable work deadline, or planning a big happy event like a wedding or milestone birthday party. In cases like these, feelings of stress can help you focus and stay motivated so you can achieve something really positive. Stress can also come in the form of new opportunities that can open doors for you and change your life. Challenges you can successfully overcome result in a positive state of mind and benefit your life. With harmful stress, on the other hand, you're not working towards something positive, but instead are trying to avoid something negative. Or you might feel like you have no control or there's no end to a stressful situation. This distress is what most people think of when they think of stress. This negative stress can show up as anxiety and worry and eventually lead to burnout or even depression. Then, within the category of negative stress, there's acute, episodic, and chronic stress. With acute stress, it might be that an issue is current and short-term. With episodic, it might be an issue that can come up at times and be a repeated source of stress. With chronic stress, it's a long-term issue that's not easily resolved. So the goal isn't to remove all stress from your life, but to give you coping skills to address negative stress and reduce its impact on both your mental health and your physical health as well. When your body goes into fight or flight mode and releases cortisol and adrenaline over situations like an unreasonable work deadline, horrible commute traffic, or a conflict with a family member, the stress response is not only not helpful, it can make everything worse. Over time, elevated cortisol levels can contribute to poor sleep, weight gain, and might have even been linked to diabetes. Long-term stress can weaken your immune system, making you more likely to catch colds, viruses, or other illnesses. Studies show that people who experience chronic stress are more likely to develop serious health conditions, such as heart disease, type 2 diabetes, or a stroke. And over time, chronic stress can change the size and structure of the brain. Not only can this lead to cognitive and behavioral dysfunction, but it can also increase the risk of mental health conditions in the future. And more immediately, persistent stress prevents you from enjoying life. So, learning to manage stress is an essential healthy habit. While there's no possible way to entirely eliminate stressful situations from your life, there are stress management techniques you can use to lessen its negative effects. There are a few different categories of techniques for this. First, let's talk about acute stress. This is the short-term stress that results from a new or unexpected stressful situation. It's possible to experience acute stress in response to minor events, like being stuck in traffic, or when reacting to major occurrences, like getting into a car accident. Although the causes of acute stress are short-term, an intense reaction can still be harmful. One simple technique that can help you calm your nervous system in an acutely stressful situation is called box breathing, which is also called 4-count breathing. To do it, we're going to inhale slowly for 4 counts, Hold it for 4 counts, and then exhale slowly for another 4 counts. Let's try it. Inhale, hold, exhale. Do this 5 to 10 times, and you should feel some improvement pretty quickly. Next, let's talk about episodic and chronic stress, which are more harmful and harder to address than those acutely stressful situations. I need to start by saying that if an external situation is causing you stress, by all means, consider removing yourself from that situation, whether it's a relationship, a job, or an environment you find yourself in. Sometimes the best thing you can do is leave or do whatever it takes to change the external stressor. Of course, that's not always possible. And depending on your personality, you might find that you leave one job or relationship just to discover that you're just as stressed out by the next one. So, how can you make life less stressful? There are 6 main strategies I'm going to suggest. First, work on developing a healthier mindset so you're less reactive to life's inevitable stressors. For example, when you're experiencing something hard, try to appreciate the fact that you're learning and growing from the experience. You can and should still acknowledge that it's hard, but you can also take pride in the fact that you're getting through it and will emerge stronger or with a new perspective. Second, watch how you talk to yourself or others. Instead of saying to yourself, "This is a disaster," try, "This is really challenging, but I've done hard things before." Instead of, "Why do these things always happen to me?" try, "Nobody deserves this, but sometimes things just happen. It's not personal and it's not my fault." When you stop catastrophizing and universalizing negative experiences, you take some of the sting out and are able to approach them with more ease and resilience. Third, a really important way to protect yourself from stress is to practice consistent physical and mental self-care, which makes you more resilient and lessens the impact of stress. For example, exercise is just as important for your mind as it is for your body. Exercise reduces your feelings of stress by increasing feel-good chemicals called endorphins and protects your body from some of the physical effects of stress by reducing those fight or flight hormones like cortisol and adrenaline. And you don't have to be a marathon runner to get the effects. Any activity at all helps. And if you don't have time for a big workout, that's okay too. Taking 2 or 3 10-minute walks during the day may be as helpful as a single 30-minute workout. Even better, walk or work out with a friend, because regular social connection is another powerful stress-reducing tool. Fourth, getting enough sleep will also increase your resilience to stress. When you're well-rested, you're less reactive. But when you're sleep-deprived, both your body and your mood will feel the effects of stress more severely. Of course, when you're stressed out, it can be harder to fall asleep and stay asleep. So during stressful times, you should be extra attentive to what's called sleep hygiene. Sleep hygiene includes trying to go to bed around the same time each night, avoiding screens for an hour before bed, and especially avoiding stimulating content like social media or negative news stories. Avoid alcohol and caffeine, and try to eat dinner earlier in the evening. All of these things can boost your sleep quantity and quality. Fifth, eat a balanced diet. Vitamin and mineral deficiencies can make you more vulnerable to the effects of stress. So eat a balanced diet and talk to your primary care provider about whether you have any deficiencies. Low magnesium levels have been linked with anxiety, so taking a daily magnesium supplement is a low-cost, low-risk thing to try, though you should check with your doctor before beginning new supplements. It's equally important to avoid unhealthy behaviors that might seem to relieve stress in the short term, but will definitely reduce your ability to handle it in the long run. Think relying on alcohol or substances, or too much time on social media or gaming. Finally, consider getting help. If you find it challenging to manage stress, and is starting to impact your relationships and ability to function day to day, it's time to get help. Talking to a therapist can provide an essential outlet. Just the act of talking or texting with a professional can take some of the stress away. Plus, a therapist can provide you with practical tips for handling your stress, tips that are personalized to your specific personality and situation. If you find your stress reactions to be debilitating, meaning they really interfere with work or relationships or just your ability to enjoy life, then you might want to see a psychiatrist to see if prescription medication could help. You might have an anxiety disorder or other mental health condition best treated with a combination of therapy and medication. For most people, however, stress can be handled with some mental health education and good self-care habits. So try these self-care habits to manage your stress today.